Now I call on Representative Kamick from Florida for 5 minutes of questions.
Thank you, Madam Chair. And thank you to our witnesses. You're in the home stretch, so hang in there. Dr. Manzanik, did I get it right?
Almost, Mazanik.
Mazanik, okay, thank you. You noted in your testimony that ransomware is currently the largest threat to the healthcare and public health sector. Specifically, what can you give me in terms of examples, and I'm looking for 3, that the Department of Health and Human Services has planned and enacted to address the growing ransomware threat, and what you are doing to help health systems and hospitals address that growing threat?
Thank you, Congresswoman. That's an excellent question. I'll highlight a couple things a little more that I already touched on, but I think one of the key ways to address the ransomware threat or any sort of malign cyber threat is through deterrence by denial, hardening the sector so it's less appealing to adversaries. There's a lot of financial incentives, other incentives that I think make it an easy target, the healthcare public health sector, or make it an appealing target, I should say. So some of the resources we have recently developed or updated and put out there are essentially resources that help harden the target and deter, hopefully, some of the ransomware actors. This is the resources that I'm referencing are things like the HICCUP, the Health Industry Cybersecurity Practices Guide, which we updated not that long ago, that has 10 mitigating strategies in it. Again, not incredibly complicated. They're basic things, tools, and steps that a diverse array of entities within the sector can take to harden their target. Things like implementing better data protection, IT asset management, those kind of cyber hygiene practices. We've also facilitated a lot of sector coordination, as I mentioned, through the Health Sector Coordinating Council Joint Cyber Working Group, working with our industry partners and other venues. That leads to a lot of information sharing where we're working to enhance threat and intelligence sharing. That, again, I think helps combat the threat. And then ultimately helping ensure from an incident response planning perspective that the sector and the entities have incident response plans in place. We have our plan that we recently updated within the department and that we're ready to exercise it should an attack occur to minimize the impact on patients and patient safety.
Thank you. Now, kind of digging into some of the Internet of Things within the hospital systems, data shows that 53% of connected medical devices and other Internet of Things devices in hospitals have a known critical vulnerability. Many of these devices do not have patches or compensating controls that are provided by the manufacturers. So what is HHS doing to ensure that these vulnerabilities are remedied with validated patches and other mitigations from the manufacturers, and that these solutions are made available in a timely manner, and I'd like you to define what a timely manner is, by the manufacturers, but also how can this also be made available to other servicers and technicians outside of the manufacturers?
Thank you for that question. And indeed, the part of what makes the sector so complicated are the diverse array of connected, interconnected legacy devices. I mentioned earlier, we recently completed a hospital cyber resiliency initiative landscape analysis to really dig into an aspect of the sector and understand the threats they face. One of the things that came out of that assessment was, along the lines of your question, a finding that a significant number of hospitals, I think it was nearly 100% within the population we looked had at least some devices that were not patched, were at sort of legacy end of life. So that's something that we're aware of, we're working to address. We provide, again, these resources that put in place a framework for each entity to use to identify where they need to update and implement patches, and we're hopeful that will be helpful. And of course, our colleagues within the Food and Drug Administration recently got additional authorities, enforcement authorities in the omnibus legislation for medical devices, which is not all internet connected devices in the sector. It's a subset of it, but they are currently working through how to implement those and address that from a medical device perspective.
Well, and when you say resources and providing resources, is that more technical guidance, or is there actually a funding mechanism that goes along with that?
So we do not currently directly provide funding to address this issue. We provide guidance, we provide knowledge on demand, web-based resources in that sense that can help the expertise in the sector more efficiently and effectively address this issue. But as I mentioned, the threat is not static, it's growing. as we move forward and consider various policy options in collaboration, working with you and your staff, one of the things, of course, we will explore is, are there more things we can do along the lines of funding to address this issue?
Well, and I've got one question left, so I'm going to get to it as quickly as possible. Last 11 years, healthcare has had the highest average cost of $10 million per breach, with a record number of data breaches in 2021. What is HHS doing in order to ensure the timely reporting by manufacturers of known cybersecurity vulnerabilities on their devices? And again, define timely.
So I would, if it's possible, I'd like to get back to you with, and we can work with our colleagues in FDA to get a little more information on from a medical device perspective. But I do want to highlight the sector is much more than just medical devices. There's a lot of additional connected devices as part of the Internet of Things,
Right.
operational technology. So I think we take a holistic approach to the risks facing the sector as the SRMA and ASPR, the cyber threats, the other threats, and certainly those connected devices exacerbate it. But we can get back to you and your staff with additional information on what FDA is doing specific to the medical devices that they have authorities over.
Perfect. I appreciate it. Thank you so much. My time has expired, Mr. Chairman. I yield.